Hello everyone, and welcome back to my channel. I am Lexi, ED nurse by day, history nerd and sewer by night. So welcome back. I'm sorry I've not been available for the last couple of months. A lot of things have happened with getting ill, being evicted, loads of wonderful things in my life, but I'm now back, so hopefully loads more videos to come. So today we're going to be reviewing and watching Scrubs. So this episode, I can't remember what it's called, but it's a very interesting episode. It's very relevant to the recent things that's happened in the last 3 years. It's about germs and infectious diseases. So let's get to it.
Tip, I got tickets to bring in the noise, bring in the funk, and I don't want to miss the noise.
Hardcore
Nurse Roberts is going to take a blood sample so we can check your hepatitis viral load. Absolutely no big deal.
I love the music.
No big deal at all. Could somebody get that?
Bambi, these tests are going to come back negative. Believe me, everybody who works in a hospital eventually gets stuck.
So this is a risk with obviously anyone who takes bloods from patients. So anyone who works in ED, on the ward, anywhere where you're taking bloods from a patient with needle stick injuries. It's very, very common, and there is a very high risk of developing some kind of disease from it that the patient may have, such as AIDS, HIV, hepatitis. I don't know what it's like in America, but in the UK, when I was a student nurse, I had to have multiple vaccines. Hepatitis B, hepatitis C. God, that was a horrible vaccine. I was ill for like 3 days with a temperature. But you are inoculated. And then when you then start working, occupational health has to then do a check every, I want to say 3 years? I can't remember. But they take bloods to make sure you're still inoculated and you've still got the vaccine, basically. And yeah, so unfortunately there is a danger if you're in this kind of job, but it's just what it is, I guess.
Dr. Dorian, I understand you might need a refresher course in hospital safety. This is a syringe. When filled with infected blood, where is the last place you might want to stick it?
In my arm.
Very good, Dr. Dorian.
One word for him.
Mr. Sarcastic strikes again. For God's sake, sir, just fire me.
Just get him to sign the damn paper.
What's this?
If you should develop any symptoms that suggest you may have contracted hepatitis B, this form simply states the hospital is not responsible.
Thanks. That's comforting.
I'm sure you'll be fine.
Hey, here's your pen.
Keep it.
Oh, the janitor's so mean.
Gee, is he gonna make it?
It doesn't look good.
Yay!
Again, I don't know how it works in the US because I'm obviously a UK nurse, but you would not get someone to sign a form to say the hospital's not liable for infectious diseases. You follow your protocol of wherever you work. So, for example, let's say I was at work and I got stabbed with a needle from a patient that I just taken blood from. Protocol is you have to first ask the patient if they've got any infectious diseases, so AIDS, HIV, all that kind of stuff. And then just fill out a form, which then shows what risk you have of developing the contagious disease. Then you have bloods taken, then occupational health will then inform you if you've got the condition. But you certainly won't be made to sign a form to say you cannot sue the hospital. Well, at least I've never come across that as a UK nurse. Any of my UK nurses or doctors out there, feel free to enlighten me, but I have never seen that happen before. And touch wood, 10 years of nursing, I've never had a needle stick injury, so.
Good shame. All you can really hope for is a supportive friend to help you get through it.
Elliot got some booty, some... What?
Elliot got some...
What? It's my Elliot got some booty
I like
game.
the dance.
Oh, come on, Elliot. It's not like anybody else knows.
What's up, porn star?
Somebody toasted that marshmallow.
Poor Elliot.
Well,
Somebody got some action.
She got some action.
Come on, it's funny.
Alrighty. What do we have here?
What you've got here, young man, are 4 cases of Legionnaire's pneumonia.
So I would start us out on IV aminoglycosides.
And make sure you check for urinary Legionella antigen.
I don't know. It could be viral considering my gastrointestinal situation.
Here comes the fart joke.
No, really. I think I may have strep pneumo.
All four of us are doctors.
Let me guess. Golf cart accident?
I love it.
Medical convention.
So, Junior, what's with the antecubital venopuncture?
Oh, I got hit with the business end of one of my Hep B patient's syringes last night.
I once had a colleague who got bit by a patient with rabies.
He's okay, right?
No, he died.
A friend of mine from med school contracted leprosy. They had to amputate one of his toes. Just popped it right off.
How about hepatitis? Scary stuff.
I'll be okay.
Oh, maybe.
I have to go check on a thing.
Oh, poor JD.
Two interns.
Oh, they're just mean, aren't they? But I suppose old doctor they have to be. But I have to say, as a nurse, I hate treating medical professionals. Some can either be really good, or some can either be really bad. Depends on who they are. So yeah, but that's hilarious. So what is hepatitis? So hepatitis is basically where you get inflammation of the liver that is normally caused by loads of infections, so viral infections and non-infected stages. Those of health problems that can cause problems with the liver that can lead to hepatitis as well. So hepatitis can be a very serious problem because it could eventually lead to liver failure and other horrible things like that. And it can be spread through, obviously, blood, sharing dirty needles, loads of things can cause hepatitis to spread. And there are many different strains of hepatitis. There are types of A, B, C, D and E. As a healthcare professional, we are inoculated to hepatitis B and hepatitis C. That's basically what it is. So it can be a serious problem, so I can understand why JD is so scared. But yeah, these doctors could be a bit, little less mean to him.
I'm gonna let those old doctors scare me. John Dorian always gets right back on the horse.
I'm so sorry you're alone, Mr. Winston, but meningococcus is highly contagious.
Can I just stop it right here? I know this is a TV show, it's not based on reality, but if you're going into a patient's room that's got a contagious disease such as COVID, he's got meningitis, you don't just wear gloves and a mask, you wear gloves, mask and an apron. Just putting it out there. Anyway.
Good news, friend. The doctor is in.
I asked for a newspaper, and they gave me a bunch of Judy Blume books from pediatrics.
I don't know anything about those. You have to read Tales of the Fourth Grade Nothing. Completely turned high school around for me. You see, nobody keeps John Dorian from moving on. Nobody.
We've secretly replaced this doctor's blood with hepatitis blood. Let's see if he notices.
The janitor is so mean.
I could be oh, you are just the worst type of person.
I don't know what it is, but I'm starting to notice something. In this hospital, there are sick people everywhere.
Da, da, da. Oh, that is so gross.
I'm okay.
You got this, JD. Zombies! So, obviously, when you choose to work in a hospital, you are at risk of getting sick because you are surrounded by sick people. There are germs everywhere. So, you think hospital will be a safe place to be, but it's one of the most dirtiest, nasty places to be because there are just germs everywhere. Even though we clean every inch of it all the time, but there are sick people everywhere. So you're going to get sick as a doctor or a nurse. To prevent this is why we have good hand hygiene. We change the sheets every day. We get patients to wash every day, and everything is wipeable down in hospital. So that's why we try and prevent infection by cleaning and washing everything. That's why a lot of patients complain that they have to wash every day, and why we change the bed sheets every day, but we do it for infection control purposes. That's also why we isolate people who are contagious. That's people with like flu, neurovirus, C. diff, COVID, meningitis, mumps, anything that's contagious will go into a side room so not to prevent infection. Any nurse or doctors will go in there wearing their PPE, personal protective equipment, so gloves, apron, masks, whatever they need. And then once you come out of the room, You will then remove all of the PPE and wash your hands. And generally, if you follow those good rules, likelihood of you getting sick is limited, but obviously doesn't stop. So, you know, I can feel for JD here. It's a very scary thing, and a lot of nurses did struggle with that during COVID, because obviously you don't want to get COVID. Me in particular, because I got long COVID after being affected from COVID at work. Happy days. So I didn't like going to work at the time. I was very scared of catching COVID, but you just got to, in no uncertain terms, you just have to man up and deal with it. It's your job. You then look after sick people. As long as you follow the correct procedures, you should be protected. I don't very often get sick from hospital. I think me catching COVID was one of the only conditions I think I have caught from a patient. It's very rare that I've never got norovirus. I've never got flu from patients that I've treated before, so it is rare, personally for me anyway. But and since long COVID, I'm now immunocompromised as well. So, but again, I got that over 3 years ago. So I've never, and again, I've never caught norovirus, never had any gastro diseases from patients who I've looked after. So, you know, as long as you follow the correct procedure, it can be preventable. But I can understand why JD is scared. It's a very scary thing to be in.
You're a jumpy little fellow, aren't you, sport? Well, anyway, your blood tests are negative, so you're fine, and I think I speak for the entire administration when I say whoop-de-doo. Wrap it up for me, Ned.
It's Ted.
You think you'd be a bit more sympathetic?
I know a guy who can take care of him for us.
Ted is weird. Anyone else find that Ted's weird?
One phone call.
I knew I didn't have hepatitis. Why did I make myself crazy over nothing? John Dorian is stronger than that.
Go on, JD.
I said John Dorian is stronger than that. Oh, Carla, could you do me a favor and just give him a follow-up neuro exam? I'm just so swamped right now.
Sure, Bambi, no problem.
Okay, thank you. John Dorian's a wuss. To avoid my contagious guy.
Carla, can you recheck Koenig and Brzezinski signs on Mr. Winston?
And why can't you do it?
I would, but I don't got no mojo working. But the mojo... I have to go lecture some med students on myocardial infarction.
Right, I think I saw them waiting for you in the you're full of crap ward.
Go on.
Yes, Colin.
You know the way.
Also, look how nice their scrubs are. We don't get nice scrubs like that. It's unfair.
Well, the work never ends, you know. I mean, every day I have to be ready for rounds. I have to take care of my patients. I have scut work and research papers due. Plus, I'm starting a new rotation, and if my internship does not go well this year, then there's no way I'm getting a good residency next year. And without the residency, there goes my fellowship. And I know that doesn't leave a lot of time for us. So on some level, I think that maybe we should make this more casual. But come on, I mean, I know I can never be casual with you. We'd just end up here again, right?
So what are you saying?
I don't know.
Then why are you saying it?
Oh my God, I think I'm saying that I can't make this work right now.
I've got an idea. Let's just, you know what? Let's just go back to the part where you said that you should be the one apologizing, and then we'll kiss again, because that was, that was good. And then I'll run to my car.
Sean, you don't understand how hard it was for me just to get to this point. I mean, if I don't do the very best that I can, I'm going to hate myself forever.
What is this obsession with being the best, huh? I mean, what is so bad about being adequate? That's what I do.
No. You don't.
I know.
I have to go back in.
All right, I'm just going to stand here and wait with these flowers, because I think in about 2 minutes you're going to realize what a big mistake you're making.
I hope so.
Okay, so in this episode as well, you see Elliot, she's really struggling to find a good work-life balance. Obviously, as doctors, they have to work really, really hard. So I don't think people give doctors enough credit for what they have to actually do to become a doctor. There's studying, there's so many exams whilst they're working full-time, and it's a very stressful time, you know? You're thrown straight out of med school to then start making these difficult decisions, and you've got nurses coming up to you going, I need this, help me! Obviously a bit less dramatic than that, hopefully. So, I can see why Elliot would potentially choose her job over Sean, but ideally she should be doing both. That you can always find time between work and life. It's very important because it will prevent burnout and prevent stress. And it's a shame that Elliot did this because Sean is lovely. He's like one of my favourite guys that Elliot dates. But it's just a shame that she let him go. But a lot of doctors and nurses and any other healthcare professional, paramedics do struggle with this life balance because you do 12-hour shifts, you're absolutely knackered, you got to do all your studying, and it's a very hard time in your life. But, you know, I do feel for her.
A meningitis patient back.
No. Hey, do you know any women who hate themselves enough to actually date me?
I date Dr.
switch patients with you? Because you asked me to. Oh, and because of your puppy dog eyes.
I see, you're full of it. You knew I was scared. Why didn't you just tell me to go in there and deal with it?
Well, gosh, Newbie, I don't know what it was about that day. Maybe I hadn't had enough sleep. Maybe my mind was on other things. Maybe I didn't have enough fiber in my diet, and I failed to do my morning business. I don't know what the hell it was, but the bottom line is, I didn't feel like spelling it out for you, and I know, you want your little speech, and that's fine, because here it is. You're a doctor. You might get sick. Get over it.
Thank you. Now, can I have my patient back?
No. Because aside from his weird Judy Blume obsession, I like him. You will be...
At some point, you might even have to give up your own sense of safety and well-being. But after a while, it doesn't feel like you're giving up anything at all.
Hey, Doc.
You know what? Let's talk super fudge.
I'm just putting it out there. In real life, you would not have the time to do this with a patient, sadly, because there's not enough of you. We're always understaffed. It's too much work, but it's very nice that JD does this at the end. So, yeah. Good on him. Good on him. And what Dr. Cox says is right. You're in the healthcare profession. You might get sick. You just have to get over it. And just hope that your colleagues will support you and your family will support you if that does happen. Like, my family were very supportive of me when I got long COVID. So, you know, it's all good, really. Anyway, thank you for watching. I hope you enjoyed it. If there's any other Scrub episodes you want me to react to, let me know in the comments and I will happily do it. So yeah, and stay tuned for any other videos coming up. And please subscribe to my channel. I would really appreciate it. And yeah, have a good day and I shall see you later.